Today I have two announcements, one regarding boosters and another regarding another mask mandate in St. Louis County. The CDC now recommends a single booster dose of the Pfizer COVID-19 vaccine for those who meet certain conditions. Those include residents who are 65 and older, residents in long-term care facilities, and people ages 50 through 64 with underlying medical conditions such as chronic lung disease, diabetes, and heart disease. Any adult who has an increased risk of virus exposure or transmission because of where they work or reside, such as a group home or corrections facility, may also get a booster. Please consult your regular health care provider if you have questions about your eligibility for a booster dose. And for more information on boosters, please go to cdc.org. Only recipients of the Pfizer vaccine are eligible for a booster dose. The CDC and Food and Drug Administration are currently reviewing evidence regarding booster doses for other vaccine types and are expected to make announcements in the coming weeks. Meanwhile, beginning today, our Department of Public Health will offer booster doses of Pfizer at all of our vaccination sites, including our 3 public health clinics in Berkeley, Pine Lawn, and Sunset Hills. Please bring your vaccine card or a copy of the card with you. For a full list of St. Louis County managed vaccination sites, please go to revivestl.com. Even though protection from any of the vaccine types can wane to a certain extent, over time, vaccinated individuals do retain a significant degree of protection from becoming infected or becoming seriously ill if they do have a breakthrough case. Vaccination remains the best way to protect yourself and loved ones from the risk of COVID. Masking and social distancing remain important protective behaviors as well. Masks work in helping to keep our cases from escalating in St. Louis County. That's why our health director, Dr. Faisal Khan, will put into place a new public health order requiring masks to be worn. It was signed this morning and goes into effect immediately. The chairwoman of the council wrote to Dr. Khan last week to assure him that she would not oppose a new mask mandate, and the state legislation does not restrict the executive branch from putting one into place. The council will meet with Dr. Khan and other members of his staff on October 5th to go over the importance of masking during the pandemic. Meanwhile, we have a mask requirement in place to help keep our children safe who are not eligible for vaccine. And masks help us mitigate the virus while we continue doing all we can to get those who are eligible vaccinated. This new mask mandate will effectively replace the mask requirement that went into effect July 26 and was challenged in court. To be consistent with the judge's orders, we're putting in place a new mask order. As Dr. Khan said in his letter notifying the council of his decision, slowing the transmission of COVID-19 requires a two-pronged strategy: vaccination plus the wearing of masks in all indoor public settings. The pushback against masks has slowed our progress in slowing this virus. The confusion caused by misinformation about masks and vaccines is dangerous. Grandstanding legal actions at the state level have endangered residents here and across Missouri. Wear a mask, get a shot, be anti-government all you want, but defying common sense makes no sense and comes at the expense of those who are at risk of becoming seriously ill or dying from this virus. And I'm happy to answer any questions.